Hi, this is Dr. Jennie Byrne from Cognitive Psychiatry of Chapel Hill. It is a rainy Monday here in Chapel Hill, and today I wanted to talk a little bit more about lessons learned from my patients. And today's topic, kind of given the weather and the time of year, I thought a good one might be depression. Seasonal depression right around this time of year when there's not a lot of light tends to be worse for people, so I thought maybe this would be a good topic. So depression is pretty common, and what makes depression a little tricky, I think, and what patients have told me is that everybody gets depressed at times. So how do you know if this is just normal, quote-unquote, depression, or whether this is more of a clinical depression that needs treatment and attention? And what can be confusing is that, like I said, everybody gets depressed. So what's the real difference between kind of a situational depression and a clinical depression? The symptoms are actually pretty much the same. So problems like low mood, not enjoying things, trouble getting out of bed in the morning, maybe changes to appetite, changes to sleep, low energy, more agitated energy. These are all things that we can experience when we are reacting to a situation. So some examples of situational depression are something really bad happens, there's a big disappointment in your life, breakup with a boyfriend, girlfriend, divorce certainly, even death and grieving, and difficult changes and transitions in life. These can all be things which most people react to with depression. So how is this different than clinical depression? Well, one of the main differences is that clinical depression can come out of nowhere. So it can kind of come out of the blue, like you're just living your life and things are going fine, and then all of a sudden you start to get depressed, either suddenly or maybe over the course of time. And this is really disturbing to people because they feel like everything's going well, so they are wondering, why am I depressed if everything else in my life is going well? So clinical depression also lasts longer, tends to last at least 2 weeks, and you really have to meet criteria by having a certain number and severity of symptoms. So in terms of understanding depression, you want to think about, first of all, is it a situational depression? Like, I just got some bad news and I'm feeling kind of down in the dumps for maybe a week and then I kind of feel better? Or is this more clinical depression that is lasting for longer and it's more severe and I'm having trouble functioning? So that's one way to differentiate. Now, in terms of treatment, what does that mean? What are some tips that can kind of help you know when to seek treatment? So one of the things I recommend for my patients, and this is something that I've actually started doing more recently than I had in the past, is to kind of track their mood and see how it does over time. So for example, if you are someone who has had a history of clinical depression and maybe you're doing well, maybe you're taking medication, maybe you're not taking medication, how do you stay well and avoid getting depressed again? Well, one way is to check in with a doctor or a therapist regularly about your depression. So typically when I work with people, I'll recommend we touch base every 3 months just to make sure they're doing well. If for some reason you can't do that, another thing that you might want to do is get in the habit of checking in on yourself in a kind of more objective way, not just subjectively, like how am I feeling, good or bad, but a more objective way. And one way you could do this is use either one of the apps that are available now for tracking mood, or I really like using something called the PHQ-9. And the PHQ-9 is 9 questions. It doesn't take long to finish. And you fill out the questions and then you add up your score, and then you can kind of track that score over time to see how your depression is doing. So for example, if you score over a 10 on the PHQ-9, that's signs of being pretty significantly depressed, and you might keep an eye on it. So let's say you're feeling kind of low and you do the PHQ-9 and you get like a 15. You might want to say, okay, let's give this maybe a week, and then you can test it again. And you're still at a 15, and then maybe you wait another week and you do it again and you're at a 15. Okay, so now you've had 2 weeks of being really down. So that's kind of sounding more like a clinical depression. And in that case, I would recommend that you seek some professional help, either with a therapist or a physician. But let's say you did the PHQ-9, you were feeling kind of low, like today's kind of a rainy day and maybe you're not in a good mood, some bad stuff is going on, and you get a 15. And then next week the sun is out and you take it and you have a 4. Well, maybe that's not a clinical depression. Maybe that was just kind of a situational or a temporary low feeling, which is kind of within the normal spectrum. So I'm going to include, we're going to post a PHQ-9 rating scale so you could take a look at it and see what you think. I think the reason, again, that this tracking, keeping tabs on things is so important is that this is what keeps people well. If you have a history of depression, it is going to at times go away. Even if you don't treat it with medication or therapy, most of the time clinical depression will eventually get better on its own. Now, it may take 6 months or a year, but it'll get better, and then you kind of get fooled into this thinking like, well, since it got better, it's not going to come back, and I don't have to keep a lookout for it. But with any kind of chronic condition, depression can come back. And the more times you've had clinical depression, the more likely it is to come back. So, for example, if you've had it one time, if you've had one episode in your life, maybe there's like a 20% chance it'll happen again. If you've had it twice in your life, now you're looking at maybe 50% chance of having another one. If you've had 3 episodes of clinical depression, well, now you're getting up pretty high. Now you're getting up into maybe 80-90% chance of having another one. So by using a tracking tool, maybe you just set it on your calendar, and once every month you go ahead and you do the PHQ-9 and see where you land. And if you hit above 10, then 2 weeks later you want to repeat it. So you do it maybe once a month, see how you score. If you're above a 10, put a note on your calendar to do it again in a week or 2. Score it again, and if you're persistently above 10 for 2 weeks, then that would be a good time to reach out for some professional help. If you go up high and then you go back down low, maybe you just kind of keep tracking it every 2 weeks or so. It's pretty quick and easy to do. The PHQ-9 is a validated rating scale that many people use in practice, and you're probably even seeing it used in primary care. So when you go to your primary care, they're probably giving you something similar to this. So again, depression, this time of year especially, a lot of us can get kind of low. Think about the difference between a situational depression and more of a clinical depression, where clinical depression is lasting at least 2 weeks and more severe with more impairment to your function. And think about ways to track it and keep an eye out for times maybe when you're feeling better. And using the PHQ-9 once a month to keep an eye on your mood. Same way, think about, you might watch your weight. You might get on the scale once a month just to kind of check where you're doing. Same idea. And if you're scoring high on the PHQ-9 for more than 2 weeks, then that would be a good time to seek some professional help. So I hope this is helpful. I hope this is a tip that you can use. I'm going to include some information about the PHQ-9 online here, and I hope you all have a great week. And I'm crossing my fingers that we don't get snow. Although the kids here love the snow, I'm hoping that we don't. So stay safe and stay warm wherever you are. Thanks, and have a great week. Bye-bye.